Good morning, my friends. And now we conduct our written scanner webinar about your questions for using the scanner device and other devices from OKB written. Now we had some questions. This question sent to us to Scanner conference, and we will start about these questions. Okay, a few questions from Roman. First, oil reduce electrical conductivity. No, oil reduce electrical capacitance and increase conductivity and not only reduce and oil the conductivity is nothing for scanner device. Conductivity, it's not good for scanner device because scanner will look the gap between the electrode and internal surface of organism. This gap, it's a dielectrical gap from the capacitor because one part of capacitor it's electrode and second capacitor it's inner conductivity of human body. And for better understanding, scanner look to human body like a part of like a capacitors. And for good working, this resonance circuit, we need increase capacitance, increase resistance. Better if it's dielectric property more and more than few mega ohms. In normal position, with the dry skin had in area of electrode is this resistance more than 1.5 mega ohm. But better if this resistance more than 5-7 mega ohms. And we use oil. Oil is dielectric. Oil increase the resistance. Also, oil reduce the gap. The gap you're reducing is decrease electrical capacitance. And change
Hvad skal I godt nu, det så?
Jo,
and
jo,
change
til
property.
nogle ting, men
I'm
ikke
sorry.
som, han fik ikke alligevel.
And change dielectrical property to using the scanner device to high voltage system. The high voltage resonance, it's a secret of efficiency of scanner therapy. More the high voltage, it's working in dialogue between the scanner device and no system because it's the electrical field. And if we have a high voltage, this voltage gap, it's a jump from the gap, jump from the dielectric involved to resonance with no fibers, not only receptors. 30 years ago, when I started working with scanner therapy, with Dr. Ivenka, etc., we had only one theory of using the scanner device. It's the old theory of no vision. And look to scanner device like a irritator from nerve receptors. But actually, in the modern state of the art, this is only part of reality, because reality is more interesting and have more possibility. For example, scanner can involve no fibers of autonomous nervous system directly, because in each blood vessels we have no fibers from the sympathetic nerve fibers, and the scanner can involve with nerve fibers and make a synthetic, sympathetic feedback to the sympathetic part of brain. But 30 years ago, 20 years ago, Manu, we hadn't any knowledge about this. It's absolutely new. 30 years ago, we have any material proofs about the scanner can work directly with the cells of tissue. But now we have a lot of studies, and we knew about the using the scanner device directly or directly the local therapy, because in the local therapy it's not working with the nerve system. We're working with the nerve system. It's indirect treatment because you irritate receptor was the receptor information start going from the distal part to the spinal cord, from the spinal cord to the brain. In the brain, we will have some reflective information, the efferent synthesis, and working go back. It's a reflectory circuit. The first reflectory circuit in the spinal cord level, and second more biggest reflectory circuit, it's on the brain level. But exactly, we had a lot of study, and we understand it's not only one part of therapy. Yes, receptor therapy is very good, it's very useful, and very useful for systemic treatment. But for local effects, we not need a dialogue with the brain, because we can get immediately a reaction, be the interaction between the scanner device and tissue without no system. It's a directly dialogue between some translator, like a nerve system, because nerve system is a translator. We can make a dialogue with the nerve system. We can make a dialogue with the autonomous nerve system. And also we can make a dialogue with the tissue directly. And 30 years ago, we haven't understanding about this very difficult term. And Dr. Ribenka, the main task of Dr. Ribenka is a theory of novism, the adaptation theory, the theory of stress of etc. etc. It's a novism paradigm. Mine focus in the local effects and a little bit autonomous nerve system, because this information is more modern. The novism theory based on the Sechenov and Anokhin physiologists and this physiologist making the base stone of this building, but it's only part of this. My focus is more modern and more easy treatment. The local therapy and local effects, it's more faster, more easy. I'm very lazy person. And I'm looking around me, and I look a lot of doctors, not only doctors, scanner users, is lazy, like me. And what is very important in the insurance, medical insurance, medicine, it's a time of treatments. Because if you operate with the scanner in the neovism paradigm, in the receptor theory, you need a lot of time, because the procedure is very long, more than 1 hour. But what is very important? Important is time. For example, 12 years ago, the Dr. Robbie Schlund and Professor Wolfgang Schulze make for me an ultimatum. 20 minutes for procedure, because only 20 minutes it's paid from the insurance, Krankenkasse. And we change some treatments protocols and make a new device with the presets to adapt the scanner device to this paradigm, to working these doctors and these scanner users, because for understanding and use the scanner device with the preset system, enough a few days if you have some knowledge about the human body, some partially diagnostics, you not need to study again and again. If you work to the systemic scanner therapy, if you work to a scanner device like a tuner of all human body, you need to study and study and study and study. In any time you never see the top of this rock. You only walk to the top, walk, and it's a style without end. Because it's more sometimes it's the art of treatments. It's not only working, it's not only treatments, it's the art of medicine. But medicine is sometimes partially is art, and the systemic scanner therapy, it's art, it's a top level in therapy. But I'm lazy person. And for us, and what's one more is important for us. The art is really hard to sell, and art really hard to study our patients. And art is not easy to make a business in Europe, because a level of our scanner customer in Europe is a little bit less in the former Soviet Union, because the former Soviet Union have a very qualified the physiology school and a physiology education. The base of the medicine is only high level. In the Europe, United States, the physiology level, the study physiology level on medical university is less, because this top level can help the practical doctors usually in normal situation. But we need to make not only treatment factor, we need make a device for doctors. And if we in our last Q&A session, the Manos asked me, it's like a chaos, because we haven't see the purpose, we can understand the finish of procedure, etc., etc. Yes, it's like a chaos, because we need extra study. In former Soviet Union, our doctors had this extra study, but this education in the Western country is very pragmatic. If this information doesn't help you, maybe some professor in university and some scientific doctors have a knowledge about it, but the practical doctors haven't any sense for use, because it can't help you. And for this time, our modern version of making information, it's more simplification for more simple users. If you have some extra information, if you have some interest, is very curious about how it exactly working the scanner device, you can educate yourself, and you can spend a lot of time for educate yourself. It's very good for making the medical art of the healing, not treatments, healing of human body. But if you working to treatments, for us, treatments is more better, because treatment allowed to sell the scanner devices. If we can explain a lot of some hard things about the receptor regulation, etc., for usually everyone doctors in Western country, these doctors look to us like not compos mentis. No, it's not so a good method of treatments. And for this time, we make one more focus for more easy using, and we make a more easy to use device, and we make more easy to use technology, because the way to the top, the ways to the top, it's not only one. And the method of Dr. Rivenka is its working methods. It's very complicated methods. It's good method, in my opinion. It's because the Dr. Rivenka is genius. It's a fact. But it's not so good for marketing. And for us, marketing is very neat, because, for example, a lot of clinical study is not for free for us. This clinical study is very, very expensive. For example, one the gene-modified mice now cost more than $200. It's a cheap mouse. Very good qualified mouse can cost $500. It's very expensive, and it's only mice. But investigations, the clinical tests and working laboratory, working of doctors, it's more extra paid. And all clinical study is very expensive. For example, if we involve some volunteers to clinical study, we make a medical insurance for each one, and medical insurance for very high price. And clinical study cost is increase. And all this clinical study cost inside the price of scanner device too. Because if we not make a clinical study, we haven't possibility to make a certifying of scanner device, because a certifying based on clinical studies.
1 second.
Okay, some questions.
Sorry, Boris. I was not meant to interrupt you. That was a wonderful explanation. Just want to tell you that I'm here and I can assist you with the questions.
Okay. The second questions. Second question from Roman. Roman, please read the second question about you, Dr. Boris, already. Please go ahead, Roman. Рома, читай второй вопрос. Или нет?
Yeah, sorry, I'm talking to a muted microphone. So the second question, okay. Dr. Boris, you already told us that frequencies lower than 15.4 hertz are used for two main fields. First, acupuncture, and second, relaxation of muscles. Or in other words, high frequencies stimulate muscles and low frequencies relax them. Is there any benefit using frequencies lower than that, let's say 2 hertz or 5 hertz, in the treatment of chronic pain, the pain that is rooted in your central nervous system, and therefore many, many years? Or can you even harm yourself that way? The Super Pro V2 runs on 15.4 hertz with the chronic pain preset, but that's the lowest it can go. Therefore, the question, if you can optimize that with going even lower than 15.4 hertz.
Okay, that's a very interesting thing. The scanner effect actually, the real scanner regulation affects the frequency about the 30 or 50 Hz. It's not only some voluntaristic frequency, because it's the frequency. I'm sorry. Рома, давай, помоги мне. Итак, на частоте 15 Гц у нас начинают появляться эффекты скэнера.
So 15.4 hertz is the frequency at which the effects of scanner start to present.
Дело в том, что на частоте меньше 10 Гц мы теряем именно эффекты аппарата скэнер, то есть вот эти системные эффекты.
The systemic effects of scanner, the effects that cause the general response of the human body, vanish at frequencies lower than 10 hertz.
Вот прямо сейчас мы провели клинические исследования в Санкт-Петербурге.
We just conducted clinical studies in St. Petersburg regarding that.
И выяснили, что если мы используем частоту порядка 30 Гц,
And we found out that if we use the frequency of about 30 hertz
на мышцах,
on muscles,
мышца расслабляется на 50%,
then the muscle in this case is relaxed
на
to a degree of about 50%. So like 50% relaxed.
При этом повышается ее сократительная активность, ну, относительно начального, более чем на 70%. То есть мышца на 70%.
And its ability to contract is increased by 70% if we compare it with the original ability to contract.
Именно сила мышцы.
So the strength of the muscle is increased.
И при этом мышца не расслабляется на 100%.
However, the muscle is not relaxed by 100%.
И нужно сказать, что при этом улучшается метаболизм самой мышцы.
And also, the metabolism of the muscle is improved significantly.
И этот эффект сохраняется довольно долго. До
And this
суток.
effect can last quite long, for about 24 hours or even more.
Если мы используем частоту порядка 5 Гц,
Now, if we use the frequency of about 5 hertz,
мышца расслабляется на 100%.
then in this case, the muscle is relaxed by 100%.
Но при этом никаких изменений метаболизма в мышце нет. Сократительная активность мышцы, становится 10% от номинальной. И это сохраняется на протяжении нескольких часов.
However, even if it's relaxed by 100%, there is no change in metabolism of the muscle, and its ability to contract is only 10% from the nominal, so it is decreased.
Поэтому как раз-таки скэнерные эффекты, они не связаны с низкой частотой.
So Skinner effects are not connected to the low frequency, to the extremely low frequency.
Если мы снижаем частоту, мы превращаем скэнер просто в обычный электростимулятор. Ничего интересного.
So to conclude, when we decrease the frequency to extremely low levels, we just turn our scanner into a simple electric simulator. So nothing fancy here.
Поэтому для хронической боли в аппарате в пресетах использована частота, которая, в принципе, направлена на определенный тип нервных волокон.
So this is why in the presets that you mentioned, the certain frequency is used because it is aimed at certain type of nerve fibers so that they resonate.
Так,
Окей,
следующий.
следующий вопрос Романа.
Да, читай.
Okay, going to the next question here.
Да,
The
читай.
third question from Roman. New one. The main book we use in the German language for scanner treatments, co-written by Professor Alexander Rubenko, basically teaches treating first the local point of pain, for instance, left knee. Is that if that's not good enough, then we start to treat the symmetry or the right knee. And if still we have time and motivation and there is still pain, we also then treat the general zone or the spine. Can the body handle that? Or does the body get confused if you treat too many areas of your body in one scanner session? During our last seminar in Vienna, our colleague said he always treats only two zones maximum at the same time because of the confusion that can appear, and then the body doesn't know what to do. So what we can say, Boris?
The scanner, it's awesome device. Why it's awesome? If you make two very, very big mistake, it doesn't mean, because the scanner was too clever, and human body is clever too. And the scanner therapy, it's interaction between the scanner device and human body. And exactly, scanner device have only part of the resonance circuit, and second part is human body. And with the scanner therapy, we have a lot of ways to treatments. And we have a lot of theory to treatments. And it doesn't confuse anyone, because all ways is good. But in my opinion, I can speak only about information with the clinical proofs, because I'm officially work with the OKB rhythm, and I have an information from some researcher, and we sometimes have a more opposite treatment technique with similar effects. It doesn't confuse everything, because a human body is very, very clever, and the facts the first. And if you если, Рома, если очень удобно, тут можно выбрать ту технику, которая ближе к пониманию. Работать нужно понятно для себя.
You can choose the technique that is more friendly to your understanding, so that you will have the full understanding of what you're doing. So it is flexible and it is adjustable. Scanner is an individualized therapy. So
And
no
you can get
confusion
good
will
results.
occur.
No
Is that correct, Boris? No confusion.
no confusion.
Okay.
Doesn't matter. How many minds, so many minds. How many doctors and professors? A lot of mind, techniques and theory. And what is what is very the first thing. Try everyone and make you own sense, because The Dr. Gorfinkel, someone say the unopened techniques, effective techniques, is too much larger number than opened. And that is very important. Everyone doctors with the scanner device, after a few years of working, make only self-own technique of using scanner device. We make some information to start, but clever doctor use self-experience. Look to self-patience, look to self-hands, and look to self-understanding. If understanding with experience, combine it with some basic information, you can get. And if you found some experience as scanner user, you may be found only maybe 2 or 3 doctors on 100 doctors with the absolutely one-to-one techniques. Everyone doctors looked like the lens to these techniques. It's okay. Collect the information and make your own therapy treatments. It's okay. Scanner is clever. Believe to scanner, and scanner believe to you. Okay, Romas.
Okay, have we answered any question from the chat yet? Or
Yes, only that.
should we first address the questions that were sent to our email and then go to answering the chat?
I think now the time for chat.
Okay, we didn't answer anything from the chat yet, right?
Yes.
Мы еще с чата не отвечали ни на что,
Да-да-да.
правильно?
Да.
Okay, so let's address the chat first. Question from Elizabeth. Boy with poor well-being for 1.5 years started after an insect bite on holiday in France. However, the doctors do not think it is related. They don't know what it is. He has inflammation all around the brain. He cannot maintain normal school attendance. He's tired and must rest a lot. Done a lot with nutrient, etc., and only small progress. His mom is now ready for Skinner. How will we help, and what is the best way?
The best way to show with patients to some qualified doctor with the scanner device. And now I put the phone number from Sergey Kozyrev. It's Sergey Kozyrev, our representative in the France. And Sergey Kozyrev have Sergey Kozyrev is у Сергея много знакомых как раз-таки высококвалифицированных докторов.
So Sergey is a good scanner professional himself. I know him too personally, and also he has many connections in scanner environment, and he knows many doctors who practice scanner in France. So he can if not help, then certainly lead you or forward you to some to certain professional that will be able to help.
In this way, making a distant.
Excuse me? The boy is living
I
on an
see.
island in Denmark. So there's no chance he's going to France.
Он в Дании. Okay, in this case, we have a good specialist in Germany. His name is Andreas Marr. So Boris can share his contacts too.
Yes.
I think it's not a problem for him to visit Denmark.
You know him? Andreas Marr. You met him?
No.
Okay. Andreas Marr.
Andreas is a doctor, and he practices scanner for how much? I don't remember. 15 years now?
И, кстати сказать, он в прошлом преподаватель физиологии Ростовского медицинского университета.
And he also was a professor at Rostov State Medical University. He's a physiologist, so a very good specialist. You can contact Andreas, and I think he will help.
So we can't do anything ourselves with the Pro.
И, кстати,
I guess contacting him would be the best first step, so he can recommend you something.
What is very important, Andreas Marr have a contacts of few friend of Dr. Marr is Professor Bochniak in Germany. Professor Bochniak is specialized to treat this pathology. It's very good if you speak with Andreas about the Professor Bochniak. Okay. Next
Thank
question.
you.
You're welcome.
Okay, next question from Light. Can Scanner be used as a first aid, and how? I always bring Scanner in my car in case of an accident.
Yes, Scanner can using for first aid and in the Europe new Europe version we make a new Europe version from the Scanner Sport devices with the preset for first aid. You need only push plus and minus button together and it go to the first aid mode. That's it.
And so remember that almost all accidents are what happened here and now. So you treat either the direct complaint, or if it's not possible to do that directly, in case of a burn, for example, you treat around, or you treat the symmetrical area.
Yes, an area.
Okay.
Next question, please.
Next question from Tony. Scoliosis. What is the simple treatment protocol? I've seen different complicated protocols using stars with many points. Is there a simple one?
Scoliosis treatments, and it's not only scanner protocol. It's a scanner protocol or add to some manual movement. You are exactly via scoliosis treatment. You need to make a few things. Firstly, you need making treatments of backbone area, and the second, you need to manually show to human body the normal position. And soon we make some particular video on YouTube. We prepare it, and soon Roman help to translate it to make answers. And on English for scoliosis treatments, maybe 1 month, and we show a new technique. It's because for explanation, it's and for this time, it's need a lot of time. I'm sorry, but actually, treatments, movements, treatment, movements, and after movements, then you manually straight the backbone. Extra treatments for fix this situation. That's it. Okay. Next question, Roman.
Next question is also from Tony. Does Dennis produce Skinner signal? And what about Enner? I understand the limitation in replying, but however.
Dennis close to Scanner on 35% maybe. Enner close to Scanner in 40% because exactly Because exactly the scanner device, the NR device, was a copy of Scanner's its early scanner device. Old time and scanner. We start making an NR device in the 2002. Yes, in 2002. But after this collaboration, the NR device producer going out from us and change technology. And our technology is very complicated because it's an individual tuning device. But now it making for the NR device from standard some parts, and from standard parts it's not close to scanner device, maybe 40%, not more, not 50. Okay, 50% of scanner device it's Avasia device and InterX, because Avasia and InterX it's a copy of scanner 97.4 from the 97. It's very old.
You mean 1997, the year?
1997. 1997. It's a very old device, and they not keep all technology properties, but use our old documentation. Okay, next question, please.
Next question is from Ingrid. Since 3 months, my daughter-in-law is suffering from a concussion after a bad fall. In a previous Q&A, somebody asked how to treat a concussion. The answer was the 3 pathways and 6 points technique. I have been doing this treatment on her for 1 month now, with no changes so far. In fact, her situation has deteriorated to the point she cannot work anymore. She has been advised to consult an ergotherapist, but she's in the wait list. Can you advise what to do? Should we continue the treatment or change it?
One moment, please. I think. Okay. Where are you from? Ingrid, where are you from? Holland. From Holland. Okay, please contact with Dr. Andreas Maar. And after you contact with the doctors Andreas Maar, maybe he has some known doctors in the Holland. Also in the Holland, I know one doctor in the Holland, по-моему, она живет, это Нина Харунжи. Итак. Окей, плюс 31, 6, 34, 0, 57, 66. Okay. The professor Nina Harunji, she is a professor. She was very old. She was a professor in Rostov Medical State University a lot of years. Now Professor Nina Harunja lives in the Holland, and you can speak with her. She is very she's known about have a knowledge about the scanner devices more than 30 years. 3 years treatments, okay. As very good for this time, continuous therapy, and try to ask Nina Karunchev, because in this situation need to correct the treatments, need to look to the patients. Okay. Следующий вопрос от Тони, по-моему. Нет.
Okay, the next question. No, the next question is just a sec. Yeah, the next question is from Light. A client with severe chronic headache. I use watermelon with pre-settings 3 chronic pain. No results after 3 treatments. Any advice?
Because you make everything from. Because before treatment with the presets, you need some education. It's short education, only 2 days, 8 hours, maybe 6 hours education, but they need this education. But firstly, the chronic, the headache, before treatment, the headache, you need to understand what kind of headache is this. It's the tension headache. Let's say и напряжение, головная боль. Рома,
Еще раз.
головная боль, напряжение. Это как у нас получится?
No, headache with tension.
Yes,
Yeah.
It's a muscle tension headache. Maybe it's a migraine. Maybe a muscle tension headache. Maybe it's a nerve headache. In this case, it's absolutely different therapy. And watermelon treatment can help absolutely. And the chronic pain preset not treat this case absolutely, because this preset the muscle chronic pain or neurological chronic pain, but head is absolutely a complicated area with the absolutely different pace. And what is the basically start area for treatments any kind of headache? The neck. The 90% of all headache treatment from the neck. You need basically, if you try to maybe use presets like low FM or use the subacute preset and put 2 pound electrodes in this area, down the ear. And maybe after 10 minutes, the 50% of headache is closed. And you can move the electrodes to the novus occipitalis area and working in one side in the temporalis area. Before treatments, we need to make a physical examination and understand what's kind of headache and choose the treatment factor after this. Okay. Вопрос от Тони. Oh, excellent question. Very interesting question.
Yeah, another question from Tony. Please, can you explain how one's frequency is chosen in scanner? In other words, 30 hertz, the delivered internal frequency is up to kilohertz.
One moment, please. What is very, very important for scanner? very important for scanner. The frequency in the menu, it's not a frequency, it's repetition rate. It's not a frequency, it's repetition rate. Repetition rate it's not an internal frequency inside the treatment pulse. Okay, now let's look to the I'm sorry. Okay. I talked about this frequency. This frequency, you can see? This is a frequency inside pulse. For this time, the starting frequency is high, as from first, second frequency, and the 30 frequency is decreased. Switch on your scanner device and switch on your scanner device in the dose mode. In the dose mode, you can see the reaction. Reaction, it's a time. It's a time of half where, of this half where. In time, the measurement of time in the microseconds. If you can see initial reaction 10 or current reaction 10, it means the period 10 microseconds, but it's only half wave. But for frequency, we understand in frequency, we need a full cycle. For full cycle, we multiply twice this initial reaction. 10 microseconds, it means 20 microsecond cycles. It means the scanner device working with the 50 kilohertz. If you see the reaction time 100, the full cycles, it's 200 microseconds. And this means the scanner device working with internal frequency 5 kilohertz. That's it. If you can find, you can type in the Google, for example, time to convert time to frequency. And you can see the online converter. You can choose in one side the time in microseconds, and in next side the frequency in the hertz or kilohertz. And that's it. Look to the dose mode. In the dose mode, the scanner device make a measurement of the time. The reaction, it's a time. Multiply and convert to frequency. That's it. And the repetition rate doesn't change internal frequency, because internal frequency depend only the human skin. That's it. Okay.
Another question from White.
Oh.
Can you recommend any specific protocols and or presettings for the treatment of the nervus vagus?
For nervus vagus, what is for nervus vagus is not so rocket science. But firstly, locate the nervus vagus. Nervus vagus between the musculus sternocleidomastoidus in this area. If you treat the nervus vagus, you need to understand best idea treat with only one side, because if you treat the nervus vagus, the numbers of pulse is decreased, maybe more than 20 beats per second. And it's a good idea if you use pound electrodes. Put the pound electrodes, 1 pound electrodes you put to a region of novus vagus, and second, put to VC7. That's it. Or you can put maybe in the shoulder. Choose subacute presets or use maybe from 30 Hz to 40 Hz with intensity more than 5 and more. That's it, and you immediately get very good vagus stimulation. And put few drops of oil in this area. And you need to sometime move the electrode, then the irradiation. Even the patients told you about the radiation to the diaphragms. In the 50%, our patients told us, oh, my diaphragm is something change. And that is very important. After this procedure, need to patients lay down more than 10 minutes. Because if your patients after this procedure maybe try to sit or stand a lot, he can break down to floor because the blood pressure can decrease it very, very, very big. Please avoid this problem. Okay, next question, please, from our sent information. Рома, читай от доктора Андони.
Okay, we are yeah. And yes, there is a very last question in the chat for now, and then we will go back to the questions that we got previously. The question from Epignosi Tamati Center. What can we do with chronic insomnia that lasts for 7 years? The person can sleep very little and only with pills.
Best way, go to Facebook profile Tomatex LLC, and you can find in the Tomatex Facebook the insomnia treatment technique. I wrote it. It's more, I haven't Facebook now because it's blocked. But a few years ago, I make for Tomatex this short protocol for insomnia treatments. Go to Tomatex LLC, Facebook, or you can find this Facebook in the Tomatex website. Tomatex is our representative in the United States, and you can treat this area, or you can meet with Tamara Goncharov, our director, Rhythm USA, and ask the insomnia protocol. Oh, no, Roman, thank you. Yes.
Okay, and another question.
From Donny.
Another question. Just a second. Just a second. Sorry for the interruption. Okay, the next question is from Dr. Andoni, and it was sent to our email previously. So the question is, as I explained to you, Please, can you check if there is a problem? The device is otherwise working well. At least I would like to know that I can keep using it with no harm to the device. My LT master does not have the same issue. Well, here's the description of the problem. See attached pictures. There are also some pictures. Working on FM V7 or V1, V3, D2, D3, etc. Then scrolling down to any swing, for example, swing 4, keeps working in FM1, FM V1. You need to go down to FM on and work okay, then scroll up to any SW to work properly. Another point, okay.
Okay,
So
need to
Roman, Boris, can you hear me?
yeah.
Yes, basically, I think that was Maria who put that question in there, but I did discuss that with Boris in a previous webinar, and I sent him an email. So I'm just waiting, Boris's reply, that's all.
No, I'm okay. This problem is solved.
No, I'm just waiting your reply. I sent you a month ago an email.
On the mail. Okay.
Oh, okay. So
because-
Boris, this is a personal question to
Okay,
you, so you can reply directly.
Yes.
Need to.
And because I didn't get a reply, I checked with Maria whether the email you gave me was correct, and it has confirmed that it's correct.
Okay.
So no need today to reply that here.
Okay, please send my I try to.
Yeah, I got your email.
У вас
Boris.
должно быть на почте, это у вас должно быть. Это вы можете сами потом ответить.
No. But my mail, please send me again, please. Maybe sometime I have a problem. Maybe some.
Maybe the email slipped
Yes.
through the cracks.
Yes, my today.
Is that the capital B, Boris?
Okay. Please send this information. I make an answer for you. Okay, for this time maybe some. Okay, next question in our chat. Input for treatment from polyneuropathy. For polyneuropathy, any kind treatment start from there. You can look to your patients. You can make a physical examination, and after physical examination, you can choose the program. It's maybe it's not so big problem because Рома, переведи, пожалуйста. Любая проблема начинается с правильной ее актуализации.
Any problem starts with the correct actualization of this problem.
Сканер-терапия – это физиотерапия.
And Skinner therapy is first and foremost a physiotherapy.
Физиотерапия не оперирует конкретными диагнозами.
Physiotherapy does not operate with certain determined diagnosis.
Мы оперируем синдромами.
We operate with syndromes.
И мы оперируем теми состояниями, которые мы видим на процедуре.
And we operate with the states that we observe during the procedure.
И как раз-таки то, что у человека полинейропатия, это, конечно, печально, но нужно лечить не полинейропатию, а нужно лечить человека.
And of course, it is sad that the patient has polyneuropathy, but in this case, we're not treating the polyneuropathy, but we're treating the certain patient.
То есть мы должны поделить, то есть что мы видим на данной процедуре. То есть что пациент с полиневропатией нам какой задает вопрос. От чего он хочет избавиться. И именно это мы будем лечить. Не полинейропатию. Он не знает такого слова.
So we need to ask our patient, what is the biggest complaint that disturbs them? Because our patient does not know what is polyneuropathy. If we ask him or her, what concerns you, like what is your biggest pain, what's your biggest problem, he will not answer polyneuropathy. He will say, okay, it hurts here, I have certain problems, this, and that, and this exactly will be what we will be addressing with Skinner device first place.
То есть здесь и выбор метода решения, он зависит только от того, что нам сейчас предоставит пациент, а не от полиневропатии.
So our treatment will depend on what the patient will point us on.
То есть, например, и у нас существует много разнообразных способов повлиять на это лечение. То есть, может быть, нужно применить водный электрод Эндховена, то есть поместить ногу, например, в тазик с водой. И туда одну пешку, другую пешку под колено поставить. Ну, вот это вот при диабетической нейропатии очень хорошо помогает.
For example, for diabetic neuropathy, we may use the wet electrode. Как он называется? Кого?
Ну, это Эндховен.
Eindhoven wet electrode. Опишите, пожалуйста, еще раз процедуру.
We take тазик этот самый.
We take yes
Container with water.
a bucket of water.
Yes, a bucket. A bucket. Put the food to the bucket with water. Put 1 pound electrodes to this bucket, and second electrode put the backside of the canoe. That's it. In this case, it's and after 50 minutes, you patients with the diabetic, maybe this patient haven't any sense in this food, told to us, oh, I 4 years never feel in my food, but now I feel a pain. Yes, because the pain come back first. But this is a good result, it's not bad result. After few procedure, these patients can feel some the sensitivity in the food. But if you discontinue this procedure, this results is reduced after a few weeks. Okay. The questions. People are a bit skeptical about this procedure. It depends about the representation. The scanner therapy, the scanner, it's most powerful and most very complicated physiotherapy device. In former Soviet Union, in the Soviet Union, the health of people it was a property of the state, and state try to cure all the people because the people is powerful. It's a power. And health is very important, and health, and what is very important, the physical therapy is a cheap therapy because you can buy the device only one time, and you need only electricity but electricity is very cheap. And you need to buy a lot of the medicine, drugs, etc., etc. And physical therapy in a climate therapy and vasotherapy is very popular in the Soviet Union. We have the biggest clinical study library and the biggest amount of a clinical study about the physical therapy, because in each hospital, every one man in the clinical or ambulatory have two parts of treatments, the drug therapy and the physical therapy. And we can treat with the physical therapy every problem with human body. And for this time, in the former Soviet Union, in Russia, etc., the scanner therapy is popular because it's a physical therapy. One device of scanner, with one scanner device, replace maybe more than 8. It's a cabinet with big and expensive devices. That's very important for us. Does scanner create similar microresonances with scanner and cosmodic? Cosmodic, it's a marketing. I know all about a cosmodic, but cosmodic, it's marketing. Microresonance anytime built in the scanner device. Study. Рома,
Да.
вот так, ну, у нас там это самое. Элизабет, я не совсем понял, что Элизабет это самое?
Elizabeth, can you put a link for this study? Okay.
All
Просит
studies,
ссылку на исследование. Мгм.
no, all studies is opened because all studies is published in Russia State Library. All Russian medical study is available. Not all for free, but available, but on Russian. Also, да, Рома, наверное, положи нашу ссылку на эту, на Эллин сайт положи. Sometime the Australian representative, Eli Tomova, translate a lot of our clinical study to English. You can find it in the scanner.com AU.
I will put the link to the
Okay,
chat now.
Could you clarify, retail it with Novus Vagus treatment?
Yeah, related to Novus Vagus treatment. To treat only one side during one treatment and another side during the next procedure, is
As
it
you
correct?
want, it doesn't matter. You can try to treat one side and one procedure. You can treat the second one to second procedure. Actually, it doesn't matter what kind of side, left or right, you treat, doesn't matter. But only one side to one procedure, yes. Okay. Thank you, my dear colleague. Thank you for your questions. Thank you for your time. Thank you if you choose the scanner devices and use it. I hope this some information helpful for you, and see you again to our next webinar in the next one. I wish you a very good autumn and see you again. Goodbye. Have a nice time. Goodbye.